Physical activity is a cornerstone in reducing the risk of heart disease and preventing secondary cardiovascular events, such as heart attacks or strokes. Recent research highlights the potential of personalized text messages to promote increased physical activity in patients recovering from significant heart events. This innovative approach leverages mobile technology to deliver simple, low-cost interventions that can make a significant difference. A study led by the University of Michigan Health Frankel Cardiovascular Center explored the effectiveness of personalized text messages in encouraging physical activity among patients who had experienced major heart events. The research, published in Circulation Cardiovascular Quality and Outcomes, is part of the Virtual Application-Supported Environment to Increase Exercise Study, or VALENTINE study. This randomized clinical trial assessed physical activity levels over 6 months in more than 200 patients enrolled in cardiac rehabilitation programs. The study found that personalized text messages were highly effective in promoting physical activity during the initial phase. For the first 30 days, patients who received these messages showed a significant increase in their step count. Apple Watch users experienced a 10% increase in steps within an hour of receiving a message, while Fitbit users saw an even more impressive 17% increase. These results demonstrate the potential of mobile health interventions to encourage healthier behaviors. The VALENTINE study specifically targeted patients who had undergone cardiac rehabilitation. The personalized text messages were tailored to each individual's context, taking into account factors such as weather, time, and day of the week. This level of customization aimed to make the messages more relevant and actionable for the recipients. The study's findings underscore the importance of context in designing effective health interventions. Dr. Jessica R. Golbis, the first author of the study and an assistant professor of internal medicine cardiology at the University of Michigan Medical School, emphasized the promise of these interventions. Our study shows incredible promise for simple, low-cost interventions delivered through mobile technology and their potential to help prevent secondary cardiovascular events in patients, said Dr. Golbis. The initial success of the personalized messages highlights their potential to make a meaningful impact on patient health. However, the study also revealed that the positive effects of the personalized messages began to diminish after the first month. Both Apple Watch and Fitbit users showed a regression in their increased activity levels as they became accustomed to the messages. This natural decline suggests that while the intervention is effective initially, its long-term impact may require additional strategies to sustain engagement. Despite the diminishing effects, the research team remains optimistic about the future of mobile health interventions. Dr. Brahmaji Nalamothu, the senior author of the study and a professor of internal medicine cardiology at the University of Michigan Medical School, highlighted the potential for further refinement. I sigh. We learned a lot in this study on how patients could better use digital health tools like smartwatches in the future, said Dr. Nalamothu. The insights gained from this study will help tailor future interventions to better meet individual needs. In conclusion, the use of personalized text messages to promote physical activity in patients recovering from significant heart events shows great promise. While the initial effects are strong, sustaining long-term engagement remains a challenge. The findings from the VALENTINE study provide valuable insights into how mobile health technology can be optimized to support patient health. As researchers continue to refine these interventions, the potential for simple, low-cost solutions to prevent secondary cardiovascular events becomes increasingly clear. This is an exciting time in the field of mobile health technology, with the promise of significant advancements on the horizon.